Hello, I'm Giovanna Forte. My company Forte Medical specialises in specimen collection systems. The device I'm going to talk about now is Peezy, a clever funnel that guarantees a midstream specimen, an MSU. Urine is full of information. It's the window to a person's health, and an MSU will provide a clear view into any problems that lie within it. Historically, methods of collecting urine from patients include peeing directly into this universal container or perhaps into a larger container so the specimen can be decanted into the tube. Either way, it's not just really messy, but between 15 and 30% of these samples become contaminated with natural flora and bacteria that are washed off the skin. This means a lot of retesting and expensive repeat appointments. What this means is that the sample may be masking the information needed for an accurate diagnosis. The dipstick test or the lab technician's detective work is made that much harder or even impossible. Consider that a urine sample can help provide insight into protein, glucose, blood, complications of diabetes, screen for renal problems, and check for damage to the bladder. These are just some of the things that can be detected from a good urine sample. If that sample is contaminated, the lab technician may as well be looking through a dirty window. He or she cannot see what they need to see. Peezy changes all that by collecting only the bladder urine, the clear window, and this is how. The really belt and braces method of providing an MSU is to clean yourself with a genital wipe first. This is provided in the Peezy kit. Peezy works with the standard universal container with the 10ml primary tube that fits into most automated laboratory analyzers, which means no decanting in the lab. Here you can see that Peezy has a nice wide handle and a soft rim around the top so that women can comfortably hold it against the body. Men hold it over the toilet because remember, the first flush is rejected into the loo below. The first flush of urine, here represented by blue fluid, goes straight into the loo. Then a small cellulose sponge expands to block the exit, sending the midstream into the tube. Overflow urine is expelled through a separate duct, which means Peezy cannot overflow. It works with both high and low urine flows from 40 to 10 millilitres a second. When you've finished, count to 10 to allow the sponge to drain, and then simply lift Peezy away from the body, remove the bottle, replace the lid, and dispose of the funnel into the clinical waste bin provided. For the first time ever, patients can deliver their sample and keep their hands clean, as well as the hospital toilet. Peezy is preventative medicine at its simplest. It works for men and women and is especially valuable for antenatal testing, for children and the elderly, where a good diagnosis is very important. Peezy is easy to order from the NHS supply chain and through our website forte-medical.com. Thank you very much. Peezy is prescribable. It's listed on the UK drug tariff. It is available to buy on the NHS supply chain. And if you want to know more, write to us at hello@forte-medical.com.